The heart is made up of 4 chambers. 2 filling chambers, known by the medical terms right and left atria, and 2 pumping chambers, known as the right and left ventricles. You may notice that the right side of the heart is on the left side of this video, and the left side of the heart is on the right side of this video. That's because when we talk about parts of the heart, we always use the patient's perspective and associate the parts of the heart with their right and left side. With that, let's go back to talking about ventricles. In a normal heart, the left ventricle is the stronger chamber, pumping oxygen-rich blood to the entire body. The right ventricle has an easier but just as important task of pumping oxygen-poor blood to the lungs ready to be filled with oxygen that we breathe in. Now that you know how a normal heart works, let's talk about a condition called congenitally corrected transposition of the great arteries. We'll just call it CCTGA to save some time. In CCTGA, the position of the right and left ventricles are switched or reversed. Now, this might not look like a big deal in this diagram, but it is. Let me explain. Remember when I told you that the left ventricle is the stronger of the 2 pumping chambers? Well, in CCTGA, the connections between the atria and the ventricles are abnormal. You have the stronger left ventricle doing the easier job of pumping blood to the lungs. At the same time, the weaker right ventricle has to pump blood to the entire body, a job it just wasn't designed for. To make it even more complicated, the connection between the ventricle and the aorta and the ventricle and the pulmonary artery are also both abnormal. Specifically, the left ventricle is now connected to the pulmonary artery and the right ventricle is connected to the aorta. So the blood is flowing in the usual way, but the mechanics used to pump the blood are very different than the normal heart. Over time, the right ventricle can become weaker, leading to heart failure. Often, patients with CCTGA also have atrial and ventricular septal defects as well. An atrial septal defect is a hole in the atrial septum that divides the right and left atria. A ventricular septal defect is a hole in the ventricular septum that divides the right and left ventricles. Patients with CCTGA can also have a narrowing between the left ventricle and the pulmonary artery. Because flow through the left ventricle outflow tract is obstructed, this is called left ventricular outflow tract obstruction, or pulmonary stenosis, and it places extra pressure on the left ventricle. Electrical abnormalities that lead to a slow heart rate and can cause the patient to collapse can also occur with CCTGA. If you have CCTGA and want to know more about your condition, talk to your doctor.